Can we just sort of focus on a couple of the other vaccines just to see where we're at? AstraZeneca, you mentioned the problems there. When do you think we will see the delivery? I think we're getting an extra 100,000 AstraZeneca vaccines. When are they going to start arriving, and when are they going to start being administered, do you think?
Well, we know that the AstraZeneca vaccine will arrive someday next week. We don't have a confirmed final date, but sometime in the early to middle of next week it will come. And our plan is, as with other vaccines, to start to roll out those almost as soon as they arrive. So really, we would bring them to our cold chain headquarters. All the preparation will be in place, and then we'll start rolling them out. And I think it's a very attractive vaccine, as you know. It's particularly suited to use in the community, less stringent conditions in terms of its cold chain and so on. All we definitely know at this stage is that we're getting 190,000 doses of that during February, and the only confirmed amount we have is 95,000 for the very early stage of March. But the announcement on Sunday in terms of a positive outcome, and really it was a tweet from Ursula von der Leyen, the President of the Commission, indicated there would be 9 million more doses available and a scale up of manufacture in Europe. So I'm awaiting really confirmation, or we're awaiting confirmation from AstraZeneca what exactly that translates into in practice. So, but it's positive again, as is the announcement again yesterday that there's an extra 75 million doses being acquired by the European Commission from Pfizer. So I mentioned at the Joint Committee on Health in the Oireachtas last Friday that since I started in this role there had been 10 changes in supply schedules for the various vaccines.
Yeah.
Since Friday there's been 5 more, right? So I mean, if anything was to be a takeaway message from all of this is the uncertainty of
Fair
supply.
enough. No, and look, there's an element of catching Mercury with a fork about it all. That being said, and look, Johnson & Johnson as well, 2.2 million doses. It looks like mainly in the third quarter. I'm curious, and I know it's impossible to put an exact picture for the reasons you've just said, but is it possible to give a rough picture of where we will be, for example, at the end of March, and where we might be, for example, by the early July, by which point, for example, Denmark are hoping to have everybody in their country vaccinated? Is it possible to give us a rough guide as to where we will be at that point?
Well, I think everyone has learned the lesson in recent weeks that making precise predictions in a kind of a sea of uncertainty is really not a wise game. It's not very prudent. Now you mentioned Denmark. We're targeting very close to Denmark in terms of the rollout rate. So it'll be interesting to see how things are in July. I don't believe it's wise to make predictions, but let me give you one set of numbers, though. I mean, there was a number floating around of 1.4 million, and that's what we were due to get. I mean, at some stage last week, we were due to get 1.4 million doses into Ireland by the end of quarter one. And of course, it's a reasonable thing to suggest that divide by 2 and that vaccinates 700 people twice, and so 700 people would be vaccinated. It's a bit more nuanced and complicated than that. The actual deployment has to take into account the dose interval.
Okay.
It's typically 4 weeks at the moment. It could be up to 12 weeks for AstraZeneca. We're awaiting guidance on that. The stock management principles, where you have to hold back supplies to ensure the availability of the second dose. And also, like, if 200,000 doses arrive in the last 2 days of March, you can't deploy those in the last few days. So,
sure.
Just to give you the example, I ran one model last night just in anticipation of this question. If we had 1.4 million doses, and in one particular model, we would have 530,000 people getting 2 doses and about 190,000 people getting a single dose. What does that mean in practice? 75,000 people in long-term care facilities, residents and staff will be fully vaccinated, 150,000 frontline healthcare workers fully vaccinated, and over 300,000 over 70s fully vaccinated, and another almost 200,000 over 70s who've received the first dose. So you get a sense of how it blends out. It's not a simple divide by 2. So now, that's not a prediction. That's a scenario for a particular set of conditions that have probably changed since I did them. Right?
Is it a realistic scenario, Brian? Sorry,
Well,
I'm not trying to pin you down to say we'll have exactly, because I agree, that's ridiculous to do that. But is that a realistic scenario?
Well, if the increases that we're hearing about in the past few days, and like we're awaiting the outcome of the AstraZeneca change, and if Moderna comes a bit earlier and if Janssen comes a bit earlier, we just can't predict. But like at the moment, we're at about probably 1.1 million doses. So if some of these increases translate into practice, and if they, the projected schedules actually translate into reality. You could get back to that. And I mean, certainly when you're looking into quarter two, and I suspect quarter two, just from our initial projections, looks like it may be the big quarter. But again, no one's going to make a prediction at this stage.
Okay.
Be something more solid.
Okay.
So this is a recorded message, Shane, as you can see.
Yeah, but by end of quarter two, which is what April, May, by the end of June, we should be in a much better place in terms of the percentage of the population that we have vaccinated. I know you're not going to give me an exact figure, and that's fair enough.
But I mean, you can be thinking of up to 1 million or more, indeed, vaccine doses per month arriving in that period. You can be thinking about that. And again, if we stick, as we have done so far, to our principle of administering vaccines as soon as they arrive, you can be talking about administering up to 250,000 vaccine doses a week. And that's where all our planning is taking place now. And I want to give people confidence about that. There's been a huge amount of work taking place in the HSE, looking at the scale up of workforce, both specialists and support, and indeed the broad range of vaccine centres that we'll be putting in place right across the country to address this. So I think that's what's coming next. And as the Taoiseach has said a number of times in recent weeks, this moves from a supply uncertainty issue to an administration issue. Yeah. And that is the big challenge to work on this. And we'll see where everyone is at that stage.
Okay.